So for me, it was around mid-March.
Even Nick Marceau's doctor suspects he has COVID-19, but he can't get tested.
And it's frustrating too, as particularly as somebody who lives alone when you're confronted with something like this.
Marceau has neither traveled recently nor is he in a high-risk group, and his symptoms aren't severe, so he doesn't qualify for a test in Ontario.
Although I had some lightly impacted breathing capability, it didn't seem to, it wasn't preventing me from performing sort of regular activities at home. So it was judged that, it was a watch and wait situation.
When it comes to the rate of testing for COVID-19 compared to other provinces, Ontario is far behind.
As you can see, I'm a little frustrated.
After struggling to build testing capacity for weeks, Ontario's now getting help from hospitals and private labs, but most of that extra capacity still isn't being used.
3,000 tests or a little over 3,000 tests are totally unacceptable. We have the capabilities of 13,000 tests a day, and there's no more excuses why we shouldn't be getting 13,000 a day. That's going to be our goal.
After orders from the Premier, health officials acknowledged the rules in Ontario should be relaxed.
Expand the criteria and, encourage clinicians to test people if they are concerned that the person has symptoms that may be indicative of COVID-19.
Experts point out testing isn't just about identifying patients and their contacts, but understanding the spread of the coronavirus, which hasn't slowed down in Ontario.
We can't fight an enemy we can't see. We can't manage an epidemic if we don't know its dimensions. We don't know where it is.
For Ontario, a renewed promise to find that enemy.
It's all hands on deck right now. And test, and don't stop testing.
Vic Adopia, CBC News, Toronto.